Our next speaker is Dr. Allyson Pollock from the University of Edinburgh, in Scotland, of course. And Allyson is a tireless international advocate for public health care and open transparency. She has spoken at almost every country in this world. I won't name them all, it would take too long. She is well recognized and well respected. Tonight she will speak on public-private partnerships.
P3s are being used to privatize almost every piece of the public sphere: roads, prisons, schools, hospitals. There is no bit of the public sphere that isn't now being liquidated, privatized, and redefined as private property with private interests.
Since we launched the Public-Private Partnership Initiative in 2002, we've actually either started or completed $4.7 billion in new P3 projects.
It's very, very big. In the UK, the government has now signed £57 billion, or that's over 100 billion Canadian dollars in P3s. It's being rolled out right across Europe with more than 70 billion euros of P3s. And of course, as you know, it's going to India, to Africa, and Canada. And it's being supported by the World Bank. Now, the P3 is a long-term contract between the public and the private sector. So, under the old system, when government wanted to build its roads or its schools or its hospitals, it would either do it through taxation or through government borrowing, because government borrowing is relatively cheap. Government can borrow much more cheaply than anyone else. And that would be provided in the form of capital, a grant, or a loan to the public authority. Now what happens under P3s is the government sells off our land, our hospitals, and our buildings, and instead goes to the private sector and asks the bankers and the shareholders to raise the money for the government, and the government says it will get into a 30-year contract to repay the debt. It's sometimes called private finance or the private finance initiative. So now what's happening is, instead of government doing the borrowing directly, it's going indirectly to the private sector, and it's getting into 30-year or 50-year contracts, and it's being tied in. And of course, the private sector is much, much more expensive. The bank, on average, you're paying 2% more in banks, but you've also got the introduction of shareholders, so they also have to be paid. And the government's argument, though, of course, is that it doesn't matter that it's more expensive because the private sector is more efficient and it's taking on the risks. So therefore, it has to be rewarded. So that's the first thing to remember, is that P3s are the direct privatization of all the buildings and the estate that we were given by our grandparents. And the second thing to remember is that it's debt. Now, what happens is you have a consortia of bankers and builders and service operators who get together and they raise the money. And this is what's happening in the UK. You can't all see this diagram, but it's quite an important diagram, because what's happening is the government goes to the private sector and it's raising the money. But there's a long-term debt mountain, so the green figures on the top are the money that the private sector is raising, the benign philanthropists. But underneath, you have to remember, you have a 30-year contract, and so the red is the debt mountain that's being accumulated. And in the UK, it's been described by the media as mortgaging our children and our grandchildren's future. Indeed, the Labour politicians, some of them have described it as going to put your mortgage on your credit card or going to a loan shark. So you've got this big debt, and the government's reason gives 5 main arguments for it. First of all, it says we go to the private sector because we've got marvelous competition. Secondly, as we all know, the private sector is wonderfully efficient, wonderfully innovative, and the government argues always provides value for money. And finally, the reason why the government likes P3s is because there's a fiscal benefit in terms of the government's own balance sheet. In the UK, the government put all its P3s off its balance sheet, so it no longer counted towards government borrowing or government debt. A piece of economic sorcery, if you like. However, last year they got into a major row with the International Financial Standards Boards, the body that sets the accounting standards for government, who promptly told the government it had to put them all back on the balance sheet, and so it now all counts towards government debt. But don't you worry, the Canadian government is committed to debt busting. It's committed to low government borrowing. And so it is arguing that P3s will help because they'll take it all off the government balance sheet.
In fact, I can tell you today that we're going to be making that a condition of provincially funded capital projects as over $20 million in the future.
So that's the first one, is that the government says that it will enable fiscal prudence, lower government borrowing, and lower government expenditure. That is an absolute myth, but it's one that you will hear over and over again when you hear about debt busting and fiscal prudence. What about competition? Well, P3s are enormously complex. They often involve bundling up 20 schools, 3 hospitals into one, courts and roads and prisons, very, very complicated with lots of subcontracts. So the small local businesses can't participate. They might get the crumbs at the bottom through subcontracts. So you've only got the very big players coming in. And in the UK, we've seen competition dry up absolutely and completely. So we're often only seeing one bidder for these multi-million-dollar schemes. One bidder. Or maybe early on you'll get 2 or 3 bidders, but then the government will choose a bidder and then have a 5-year negotiating phase where the contract changes completely, and so do the figures. So there is no competition. At best, you have an oligopoly which sets the prices and determines what happens. So there is no evidence on competition. And I know some of you will be challenging my evidence, and so I would refer you to our website where all our publications are and where we've published all the academic research that underpins my talk. Now, the second thing is, what about this wonderful efficiency and innovation of the private sector? Well, as I've said, government borrowing is always the cheapest way of raising finance. And so a P3 has to show that it's both value for money and affordable. Now, here is a chart, and you can't see it, but if I simply tell you that on average, the annual cost of capital to a hospital was about 6 to 7% of its income. So for every dollar, it would spend 6 cents. However, under P3s, some hospitals are now paying out up to 34 or 35 cents in every dollar. So you'll see a doubling or tripling in what's required. Now imagine you sign a P3 on your house, and overnight your rental, the money that you must spend servicing that debt doubles, but your income stays the same. Then something has to give. And that's exactly the same as what happens in hospitals and schools and roads and prisons. Now, it's easy for roads because you just bring in a toll and you can charge people for going over the bridge or over the road. Harder for schools and hospitals. So what you just simply do is you have what's called an affordability gap. And this is a government's term. It recognizes that P3s are expensive, and there's a gap between what the public sector can afford to pay from its budgets and what the private sector wants. So it meets that gap by cutting services, closing hospitals, so you go from 3 into 1, reducing beds, but it also means you have to reduce the services in the community, mental health services, primary care, podiatry, etc. It also has a big effect on staff, and in our research we've shown not just a 30% reduction in beds, so I'm showing a slide here of hospitals and the scale of the bed reductions under P3s, but also major job losses. You're raiding the revenue budget to pay the bankers and the shareholders in these companies. The biggest cost, as our doctors at the table will tell you in healthcare, is your staff costs. It's the biggest element of any budget. And so you have to raid the staff budgets. And so you cut the staff or you change the skill mix, employing, as one of our health ministers described it, ward hostesses instead of nurses. And I kid you not, so these documents, the government was very foolish because it released all these business cases and we were able to analyze them and show the government's own data. These are the management consultants and advisors to the government, which was saying for each P3 signed, you're going to see 1,000 job losses, about 25% of the workforce and the beds. So I think this is very important to remember. And some of these losses will be disguised. They won't be from the hospital, they'll be from the community and the primary health service. So that's the affordability issue. That's how the private sector is more efficient. It simply closes beds and closes hospitals. But in the process, these efficiency savings are known as externalities because you're externalizing the costs to the patients, the community, the carers, and the staff. But the private sector is efficient because it's externalizing those costs. So this is how the affordability problem is dealt with and the efficiency of P3s. Now, we have looked at all of the first wave, around 20 hospitals in England, the P3s. And this is being repeated for schools, for roads, for prisons. This is a huge public policy, which is totally discredited in the UK and very well understood by the ordinary person in the street now. What about the second test, value for money? Your Canadian government says it will not sign any deals unless they're value for money.
We know P3s save money, transfer risk, and add great value through design innovations and private sector ingenuity.
How many of you heard that term? And the reason why we're paying such a high premium to these bankers and shareholders is because they're taking on the risk. And so you want to reward them for that. Fair enough. So our government, a couple of years ago, said we've now signed more than 400 projects, so we've got a really good evidence base, so we're going to look at the value for money. We've got sufficient evidence to assess the early performance of the program. So what was the evidence that they provided? And the reason why I'm going to show you this evidence is it's because the evidence that the Canadian government and the BC government is quoting over and over again. The only bit of evidence they could provide around risk transfer was that projects were coming in on time and on budget. Well, I should hope so at the price that's being charged. And they used this figure that 70% of non-P3 projects, i.e. the public projects, were delivered late, and 73% were ran over budget. Now that's terribly important because that's used in all the modelling when you're comparing the public and the private sector. And it's also used by the federal and the provincial governments to justify the policy. They keep quoting these UK magic figures of 70%.
We're getting at least $131 million in additional benefits on the Sea to Sky Highway. At least $92 billion $92 million in additional benefits in the New Canada Line. $39 million in additional benefits in the Abbotsford Hospital and Cancer Care Centre.
Nevertheless, we took it at face value and we thought, let's look at the evidence for the 70% running over time and budget in the public sector.